Hi there, this is the first video in a three-part series where we'll guide you step by step through everything you need to know about founder, from understanding the condition to proper hoof care and long-term management. In this video, we'll begin by exploring the condition itself. What exactly is founder? We'll break down the overall concept behind this serious hoof issue and explore the main causes of laminitis. We'll also cover what to watch out for in your horse's behavior and movement. And finally, what to do when you recognize the symptoms of acute laminitis. In the next video, we'll go over how to properly care for the hoof once founder has set in, including how to trim it to prevent further damage. And finally, in the last video of the series, we'll focus on how to support and manage a horse living with founder, so you can help them recover and stay as comfortable as possible. So let's start with our first video. What is founder? Founder, also called chronic laminitis, is the stage where the P3 coffin bone has rotated and there is internal damage to the hoof. This happens when acute laminitis was not brought under control in time. However, it's not always black and white, and it doesn't necessarily mean you neglected your horse, causing it to progress to the chronic stage. Sometimes the transition between the two stages happens extremely fast, and some horses don't show all the clinical signs. Theoretically, in the first acute stage, we have inflammation, where if you take early action, your horse can recover without causing damage. The coffin bone did not yet rotate, between brackets further. Why do I say further? This is because a horse that is already foundered, meaning the P3 yet rotated, can still go through new acute laminitis phases in the future. Each new episode can cause further P3 rotation until the hoof stabilizes again. This means that founder can become a vicious cycle between acute and chronic phases, where every episode can cause further damage and allow the P3 sink further until it eventually penetrates through the hoof sole. What are the different causes of laminitis? Now, we will take a deeper look into each of these plausible causes: diet, hormonal and metabolic disorder, illness and inflammation, mechanical, medication-induced, stress and trauma. Let's start with the most common cause, the diet-related cause. Too much sugar and/or starch may lead to laminitis. Where do we find those sugars and starch? Well, rich spring or autumn pastures can trigger laminitis, especially in insulin-resistant horses, for example, those with equine metabolic syndrome or Cushing's. This due to the high fructan and sugars that it contains. Carrots do also contain a lot of sugars, like apples and other fruits. Industrial horse grains also contains a lot of sugars and starch to make it more appetizing for horses. So a grain overload can also lead to laminitis. Do know that overweight horses are more prone to insulin resistance, which increases the risk of laminitis. Hardy breeds like, for example, Shetlands, Exmoors, Haflingers, Arabians, and some Spanish horses are more prone to laminitis because they evolved on sparse, poor forage, and their metabolism can't handle rich diets or lush pasture. Now let's talk about the next likely cause of laminitis: hormonal and metabolic disorders. Horses with EMS, equine metabolic syndrome, are insulin resistant, making them highly prone to laminitis. Horses with PPID, also known as Cushing, often have high cortisol levels, which affects insulin regulation and can trigger laminitis. You can easily recognize Cushing syndrome in a more advanced stage by the curly coat, muscle loss, especially in the back region, resulting in a sunken back appearance and a hanging belly. Another possible cause is illness and inflammation. Serious illnesses like retained placenta or pneumonia can release toxins into the bloodstream, triggering laminitis. This is also the case with colic. Imbalance in gut bacteria can lead to endotoxins that trigger laminitis. Our next cause is the mechanical cause. Repeated work on hard ground, such as roads, can cause inflammation in the laminae. That said, it's certainly not harmful to expose a horse to different types of footing, including hard ground. What we're referring to is excessive trot, or canter training on roads where the impact can lead to strain and inflammation. The next cause that can trigger laminitis is medication. Some horses react badly to steroid medications, especially those with underlying metabolic conditions. Corticosteroids have anti-inflammatory effects, so they are used to treat inflammatory diseases in horses. A potential link between this treatment and the development of laminitis has been suggested. Our last cause is stress and trauma. Long-distance transport and standing in one position for extended periods can contribute to laminitis. Excessive trimming or injury can damage the laminae and lead to inflammation. In this picture, the horse no longer has any hoof wall left to bear weight on. We've now gone over all the possible causes of laminitis. But the question now is, how do we recognize the symptoms of acute laminitis? One of the most common symptoms is the horse leaning backwards. This happens because the horse is experiencing inflammation in the hooves, most often in the front ones. To relieve the pressure, the horse shifts its weight to the hind legs. Because of the extreme pain, the horse will mostly stand still. But if it has to move, it will do so with great difficulty. If you notice these symptoms, it's more than urgent to take immediate action. In the early stages, the signs can be more subtle, like in this video. The horse may appear slightly lame, as if walking on eggshells. Unlike an abscess, you often can't tell which hoof is affected. With laminitis, remember, the horse tries to shift weight to the hind legs, like in this video. One of the first clear signs is how the horse turns. It will spin, like performing a stiff dressage pirouette. Another obvious symptom is increased digital pulse in both front legs and hot hoofs. So now that we know how to recognize laminitis, what should we do when we see these symptoms? First, immediately remove the horse from green pasture, as it can worsen the condition due to the high fructan content. If that's not possible, use a grazing muzzle to limit intake. Do not feed your horse anything other than soaked hay. Soaking hay helps reduce its sugar content, which is crucial in managing laminitis. Call your vet. This is an emergency. While you wait, you can place the horse's front hooves in cold water or ice to help reduce inflammation. That brings us to the end of the first video in this series. I hope you enjoyed it and learned something valuable. Thanks for watching, and see you in the next one. Bye-bye.